Hi and welcome back. This is Dr. Farida Rajan Ibrahim Omasundi, and today I'm going to discuss stroke in details. So if you are new or if you haven't liked this channel yet, please do like, share and subscribe. So what is a stroke? A stroke or cerebral vascular accident is a sudden loss of brain function due to a disturbance in blood supply, either from a blocked artery, which we call ischemic stroke, or a ruptured blood vessel, what we refer to as hemorrhagic stroke. So basically, there are mainly two types of stroke, which is ischemic stroke, which accounts to about 85%, and the second being hemorrhagic stroke, which accounts to about 15%. And you can also discuss transient ischemic attack or a TIA, because sometimes mostly there is confusion between what a TIA is and stroke. So coming back to ischemic stroke, which is the most common type, accounting to about 85%, this is caused by occlusion of cerebral arteries leading to brain infarction. And like I already said, this is the most common type. The second type is hemorrhagic stroke, which is caused by rupture of a cerebral blood vessel resulting in bleeding into or around the brain, and this accounts to about 15%. And for a TIA or a transient ischemic attack, this is a mini stroke where symptoms last less than 24 hours and they resolve completely. So there is no infarction on imaging, and a TIA can be a warning sign of a future stroke. So coming to the causes and risk factors, I'll divide them into modifiable and non-modifiable. So for modifiable risk, you can have things such as hypertension, which is the most important. You can have diabetes mellitus, hyperlipidemia, atrial fibrillation, smoking, alcohol, sedentary lifestyle, obesity, and carotid artery disease. And for non-modifiable factors, you can have things such as age, mostly more than 55 years. Males are also at high risk, a family history of stroke, and a prior stroke or a TIA. So what are the clinical presentations of a stroke? So mostly patients will present with hemiparesis or hemiplegia, where there is one-sided weakness or paralysis. They can have aphasia, which is difficulty speaking. They can present with facial drop, which is often ipsilat low. There's also sudden visual loss or diplopia, where they can present with blurred vision. They can present with ataxia, vertigo, altered mental status, where there's confusion or stupor, and severe headaches, especially in hemorrhagic stroke or subarachnoid hemorrhage. So coming to the investigations that one can do, you can do your baselines, your full blood counts. You can also do other baseline investigations, and you can also do your CT brain. You can do your MRI brain, which is most sensitive for early ischemia. You can do your CT angiography to assess vessels occlusion or aneurysm. You can do an ECG to rule out atrial fibrillation. You can also do your carotid Doppler to detect carotid stenosis or plaque. And what is the management? So depending on how the patient presents, you can do your management according to the presentation of the patient. And just for secondary prevention, you can do your antiplatelet therapy, where you can give things such as the aspirin or clopidogrel. You can do your anticoagulation, where you give your warfarin. You can do strict BP and glucose control. And like we already mentioned, if the patient is smoking or alcohol, you encourage cessation and lifestyle changes. Basically. So that's just brief on the prevention of treatment. And coming to the complications of a stroke, mostly you can have hemorrhagic transformation, brain edema or herniation. Patients can come in with seizures, pneumonia, DVT, or pulmonary embolism. Patients can even come in with depression, post-stroke dementia, and sometimes even permanent disability. And for the prognosis, it depends on the stroke type, the size, the location, the comorbidities, the treatment time. So you can also do your early rehabilitation where there is physiotherapy, speech therapy. That will improve the outcome and the overall prognosis. But bear in mind that mortality is higher in hemorrhagic strokes. So that's just a brief presentation on stroke. I hope to see you in the next video. Please follow for more. Thank you.